So today we're going to talk about biological dental fillings, what materials we use, what materials we don't use, how do we recommend to keep them, how long do we think they're going to last, how to prevent them hopefully, difference in materials, 3D printed, direct, so we're going to have some fun today. So dental fillings are the most common restorations in dentistry. Usually a dental filling is required when a patient has a cavity. What it does is that it creates a cavity or a cavitation inside the tooth. We need to clean that out, clean the bacteria out, and then that void or that hole that is left, we fill it out with a dental filling. Also, another possibility of doing a dental filling would be if you have a replacement of an old dental filling. For example, safe mercury amalgam removal technique, which is a technique that we use here at our office. So once this filling is removed, there's a gap left in the tooth that we need to fill out again with a traditional filling. If a cavity was too small, maybe not even a cavity, but just a demineralization area in the tooth, we can also look for biological ways to remineralize this tooth. So in most cases, if the cavity is small, we try to do it without anesthetic. Very little to no sensitivity during the procedure. It's also pretty fast, but if the cavity is too big, it's indicated to place a little bit of local anesthetic so that the patient does not feel any pain. So if you don't treat a cavity the right way, when cavity is already formed, right, when there's already a hole in the tooth, there's no way to remineralize it. If we leave it untreated, what's gonna happen is that it's gonna slowly evolve into a bigger cavity. A huge cavity is gonna start hurting. When it hurts, it's already infected the vital part of the tooth, which is the pulp, which is the living part of the tooth, the heart of the tooth. Once the pulp, the living part of the tooth is infected, there's no way to come back from that. Unfortunately, the teeth will die and then we'll have to look at different alternatives for that. So ideally, once a cavity is found, you need to treat it as soon as possible. So there's different ways to do fillings, and that in most cases it depends on the size of the filling itself, right? Small fillings, as we said before, that in most cases we do without anesthesia, those are easier handled directly. So we will use a direct composite, BPA-free composite, which is very important, biocompatible, that does not leave any traces of microplastics or could cause any irritation on the patient's mouth. But when the cavity was too big, or when the replacement filling that we're doing, let's say we remove the mercury filling, and we're gonna replace it by a new biocompatible filling. If it's too big, okay, it's better to do it indirect. We will prep the tooth, we will take a digital impression, so it's just like taking pictures inside the mouth. We will send this to our dental lab. Immediately we will design it by computer and we will print it in our 3D printer. With our 3D printer, we can print biocompatible resin. The beauty of it is that it's cured outside the mouth. It doesn't liberate any monomers in the patient's mouth. It doesn't constrain. You simply cement it. It fits perfectly, and then you're done. Okay, so mercury fillings are not safe at all, okay? They all contain mercury, so our recommendation is not to get them placed. If you have in place, to remove them safely. So part of the processes that we do is the safe mercury amalgam removal technique. So patients that come to us that they have had this type of fillings done before, they've already read a little bit or they've educated themselves a little bit and they want this removed a safe way. So they will come to us. We will use a series of protection measures to them, which include a dental dam, double aspiration, an aspirator outside the mouth, nasal oxygen, and all this means to protect the patient from inhaling or swallowing any of this toxic material that is mercury. And then, when this is removed, we'll replace it with a biocompatible alternative such as BPA direct composites or 3D printed biocompatible resins. So what happens if you remove toxic materials such as mercury from your fillings in an unsafe way? Most of it you're gonna swallow, the other half you're gonna inhale. If you inhale it, it will go into your respiratory system, it will go into your brain. If you swallow it, it will go into your gut, it will kill your microflora. So when all of this toxic material goes into your body, there's links that show neurodegenerative diseases such as Alzheimer's and Parkinson's, because mercury will be stored at the base of the brain for as minimum as 16 years. Of course, we do our research and we try to use materials that are as safe or as bioinert as possible. So our composites, they're BPA free, they're BSGMA free, which means that they're not gonna put any sort of footprint into our patient's health. The ones that we do 3D printed that are indirect, okay? The reason that we like those a lot is because since they're done indirectly, we'll make sure that the fabrication process and everything is done outside the mouth. So it's a little bit more precise, especially for bigger restorations, but also everything is done out of the mouth. So the process is super simple. It comes in, we cement it, and this again is a biocompatible material. These are biocompatible resins that they don't release any monomers in the patient's mouth. They don't have any microplastics. They don't have any BPA, so it's as safe as possible. So of course you see when you select the material on a patient-to-patient basis. If you have a patient that grinds their teeth a lot or something like that, not only we're gonna try to control that grinding or that clenching with a sleeve device, with a splint or something like that, but also we may choose a filling material that is a little bit more durable, that is a little bit harder. We don't use the same material for every patient. We select the specific material for every specific case. Constant oral evaluations at least once a year will ensure that we know, or that your dentist will know, if a resin needs to be replaced or if a filling needs to be replaced. They will show signs of leakage, right? They will start staining on the edges, they will wear a lot. So a constant follow-up, at least on a yearly basis, by your dentist is important for you to know if one of these fillings needs to be replaced. To summarize, I mean, a conservative dentist or a biological dentist should look for that, to be able to try to conserve as much of your own tooth structure as possible. We try to make the cavity, we try to prepare it as little as possible, right? Trying to maintain as much of the sound tissue as possible. We try to select a material that's best for every specific case. We try to understand if the patient requires a different material or another material, if it's harder, if it's softer, if it's more aesthetic. And also we try to select materials that will cause the minimum impact to your patient's health. And also constant evaluation, because prevention is more important than reaction.